In 1985, Robert Johnson Pew Memorial Trust put out a request for proposals to begin healthcare for the homeless projects nationwide. There was a small group that was formed here in DC to begin to know how best to do that. One thing that we were committed to do was to make sure we wanted to be wherever the people were. We didn't want to just build a health service where people had to come. We wanted to be in the shelters.
In my prior life, I worked at the National Association of Community Health Centers, and I recognized there was a position open at Healthcare for the Homeless, which was the predecessor of Unity Healthcare. And I actually applied for the job. Not that I was unhappy where I was, but I got interviewed, and eventually on October 22nd, 1990, I was asked if I would become the executive director of Healthcare for the Homeless.
When my father and others came together to start Healthcare for the Homeless, my father reached out to me, dragged me in for pro bono legal service, and I worked with Unity to help on the bylaws, and I filed the application for tax-exempt status with the federal government, the 501c3 application. And so I knew Unity, understood what it was about, and slowly began to appreciate all the efforts that my fathers and others were doing to reach this homeless population in terms of their healthcare needs.
I started with Healthcare for the Homeless Project in 1999. Over the years, working with Dr. Getches and Vincent, it has been so amazing just to see their walk with serving the community. It just showed that awesome spirit of not giving up in spite of funding. It just has been an amazing journey to see them steadfast and never giving up.
I've been with Unity for a little over 30 years. I started in 1989 as a receptionist at CCMV. Just thinking back to when we started, we would have our staff meetings at Christ House in the cafeteria. I mean, the entire staff, the drivers, the nurses, the doctors, the medical assistants, we'd all fit in that little area. So we went from that small area to obtaining the PBC clinics, the Department of Corrections, to Unity now where we have over 1,000 staff members. Just that growth and that progression is just amazing to me.
I think the greatest strength of Unity Healthcare is its staff and the commitment and the mission that they are prepared to implement every day. On front lines, even here in the administrative office, everyone is committed to Unity and its mission.
I think the company and patient culture at Unity is really one of collaboration and of a mission orientation. So it is amazing how many of our staff are committed to helping people improve their health outcomes and their health experience, no matter what their background and what their ability to pay. And that creates a patient-centered culture where the staff and patients are focused on improving their health outcomes.
I have a long history with Unity, and especially Vince Keane, who has done a fantastic job at being the CEO of the organization. I've worked very closely with Vince Keane now for a while. He's been a good friend, and he's been such a dedicated health leader in the District of Columbia. And being able to work with him is such a delight. In fact, we've been working with Vince Keane for some time now around what I've been trying to do, and that is to create a comprehensive healthcare system in our communities in the District of Columbia, especially on the east end of the city in wards 7 and 8, where there's such a desperate need for more services.
About 11 years ago, I was doing too much exercise and got a little hernia in my navel. And right away, Columbia Road referred me to Providence, to a surgeon that removed it. And he told me he'd found liver cells on it. And it meant I had a cancer. All these I wouldn't have gotten except for referrals from Columbia Road. You know, as a poor person, you don't get to see these therapists unless you have money. So if Columbia Road saved my life.
I want the community to know that we are there for them. I want them to realize that we want to provide the best care possible. We serve 100,000 patients a year, almost 500,000 visits. Who's going to fill that gap?
Unity has 35 years of experience providing care to the community. We have prepared for emergencies. We are innovative, so we were piloting telehealth. We have been shoring up our electronic systems and our electronic medical records. We've changed the way we make appointments. We're now utilizing the portal. So over our 35 years, each innovation has prepared us for a time like this. And in a time like this, we'll continue to hone our systems in so that when the next emergency comes, and for the next 35 years, emergency in the community doesn't mean that we close our doors. Our doors have been open for 35 years and we'll continue to see patients. Our doors will always be open.
Over the last few years, we really have embraced this concept of healthier you, healthier communities. And that is really critical to us. It's about our individual patients who come into the health centers and helping them on their health journey, but also it's about our community. And we are so proud to serve the District of Columbia and all of its residents and anyone who needs care.
I want to extend the heartiest of congratulations to Unity, to the Unity family, and all those who have been associated with Unity over the years, the board members who give unstintingly of their time, their resources, and their efforts to make Unity what it is today. And I look forward to continuing to work with Unity in the capacity I'm in now.
It is great to be part of an organization for me for the last 30 years. It's been great for me to have been able to build on the initial 5 years of Unity, because the vision, the inspiration, and the commitment of those who started it was something that I was able to keep going. But we must always remember our roots. It has been a gift to have worked with Unity over the last 35 years. Now, on our 35th anniversary, I wish we were able to celebrate and have many other things that would associate with an anniversary, so we're going to have to wait. But I do wish all of our staff, all of our donors, all of our patients, I wish them well. I'm grateful to them for what they have done, and the patients are the ones that give us the reason to be doing this.